Hi, I'm Dr. Sharon Stills. I'm a naturopathic physician. I have a practice in Tucson, Arizona. My practice is focused on women's health and well-being. I do a lot of bioidentical hormone replacement, anti-aging. I'm trained as a naturopathic physician, so my practice consists of functional medicine. I'm also heavily trained in European biological medicine, so I make a fusion of the two with all that's cutting edge to deliver the best medicine available to patients out there. I absolutely work with patients in their dietary needs. Naturopathic medicine, one of the foundational principles is what you eat is going to affect how your health is. One of the things I use with my patients for about the past, I would say 6 or 7 years, is food sensitivity testing. The test that I use is the Alcat Test. I've been using it, like I said, for about 6 or 7 years, and I've had wonderful results. The patients really have been the ones that got such great results that have encouraged me to keep on using it, because when patients come in and they get their Alcat test done and then they follow the results, they come back, I'm able to use less supplementation with them and they get symptom relief and build better health. I've had so many patients over the years use the Alcat. Some of the things that come to the top of my mind when I'm thinking about who's benefited is I've had patients who have had chronic migraines for 20 plus years, and when we put them on the Alcat diet without any other supplementation, their migraines have gone away. Patients who have suffered from IBS, and just by following the Alcat diet, their IBS symptoms are gone and they're able to go on and live healthy, normal lives. I use the Alcat diet whenever I'm supporting a cancer patient nutritionally. It's a way for them to mobilize their immune system against fighting the cancer and not fighting against foods that they're eating. I love using the Alcat diet when I'm working with women to help balance their hormones. It's very important that we pay attention to nutrition when we're balancing our hormones, and getting the food sensitivities out is key. So the Alcat goes hand in hand when I'm working to balance women's hormones. One of the things I tell my patients when they're getting ready to have their Alcat draw is that they need to be willing to participate with the results no matter what they are. Sometimes the results are what we expect, and sometimes the results are quite uncharacteristic, and it's quite a stretch for the patient to really change their diet. So I always make them say before they're going to invest their time and money to be sure that they're going to do whatever the results say. And then together we work to analyze the results and make it doable so they can incorporate it into their life, and that the diet becomes part of their healing process and not a stress for them. When I'm working with patients and we're talking about the diet, one of the main reasons I tell them that we need to Alcat test is because theoretically we know that certain foods are highly allergenic. We know that citrus and eggs and corn and wheat and dairy and sugar and soy are very allergenic in many people in the population. But what we don't realize is that sometimes we're eating broccoli, and we all think broccoli is a great food. It's anti-cancer and high in antioxidants, and that we don't realize that broccoli could be what's causing our problems. So I tell them that I can't really figure out for them beyond what we therapeutically would know just from many populations about wheat or dairy being symptomatic, but that the Alcat is the only way to help me figure out that perhaps broccoli or apples or a food that we consider healthy is not healthy for them at this time. One of the reasons I became a doctor was because I had my own health issues. I suffered with asthma and allergies for many, many years, and I cured myself by getting wheat and dairy out of my diet. That was the first step. And when I found the Alcat diet, it was nice to be able to test myself and be able to refine what I was eating and be able to really learn the value of rotating the foods. So one of the things I tell my patients is not only are they going to find out their sensitivities, but one of the things that's priceless that they're going to learn from doing the Alcat diet is that they're going to learn the art of rotation. And that's something that many of us really weren't taught and don't practice. We're all creatures of habit. We all go to the store and buy the same foods. We go to the restaurant and order the same meal. And rotating the food is just invaluable and a very big piece in building good health. Hi, I'm Dr. Sharon Stills. Thanks for stopping by my blog site. I wanted to talk to you briefly about your diet. We all know that diet is an important foundation of having good health. One thing that's very prevalent is food allergies and food sensitivities. Now, many of you may have gone to a regular allergist and been tested for food sensitivities, but what you're really being tested for is just IgE reactions. These are foods you eat that cause your mouth and throat to close and your lips to swell, and you may need a trip to the emergency room to deter the reactions. What we do here is we use Alcat testing. And Alcat testing is a way to test your delayed sensitivities. You can eat a food on Monday, and on Thursday you can have a reaction from it. There's literally no way to really figure out by keeping food journals what that food is that would be causing the sensitivity. And that's why I offer to you Alcat food sensitivity testing. It's a simple, easy way to find out what foods you're eating that are causing your health problems. These problems can be anything from migraines, to fatigue, to hormone imbalances, to sleep disturbances, to low energy, to autoimmune issues. And I'm very pleased to be able to offer this to you.